Austin creative workers who've been financially impacted by the pandemic can apply for up to $2,000 in grants for things like rent, bills, and groceries. The Austin Creative Worker Relief Grant is a $3.5 million fund. The definition of creative includes people who work or worked in the arts, music, film, fashion, museums, and preservation, and more. We've got a link to atxrecovers.com at our website for more information, applications, dates, and eligibility.
It's been less than a week since visitation rules changed. Certain nursing homes and assisted living facilities in Texas are now allowed to have visitors, but some family members of residents came up with their own plan instead. KXAN's Avery Travis explains how the Essential Family Caregiver plan would work and why it's catching on in other states.
It's just something you don't want to let go. You just want to keep holding her.
While families of some long-term care residents celebrated,
The rest of us!
others rallied outside the Capitol.
And as soon as I saw the criteria, my heart sank because I don't know how my son's facility could ever possibly meet this criteria.
In order to make visits happen, homes must have no active cases and be adequately staffed. Kirby's 28-year-old son is nonverbal and lives in a state-supported living center in Denton, where nearly 24 residents and staff have active cases of the coronavirus.
If we were to get past the other criteria and we have the plexiglass, is his staff going to have to physically restrain him and hold him behind the plexiglass? Are they going to drag him away when he starts banging his head and screaming and crying?
Instead, she's asking to be designated as an essential family caregiver. In just 4 days since the protests, more than 3,000 people have added their name to this petition to the governor. States like Minnesota and Indiana already have this plan in place, where one family member or guardian can come inside the facility for a few hours a day. As long as they had a prior relationship with the resident, they get a negative COVID-19 test before they arrive, they wear a mask, and they stay away from other residents and staff.
We would go through the same screening process as the other employees. There is no one on the face of the earth that has a more vested interest in the health and safety as our loved ones.
In Austin, Avery Travis, KXAN Investigates.
The Texas Health and Human Services Commission says the new rules do allow for in-room compassionate care visits if a doctor can diagnose a decline in the resident's physical or mental health. That can include documented weight loss, decreased appetite, or inactivity.